Percussion of the heart region. Before examination, you must greet the patient, introduce yourself, take adequate consent, make sure wash your hands, put on gloves, and choose correct position. In our case, standing, upper body, undress it. Then perform percussion, which include determination of relative cardiac dullness, vascular bundles, diameter of the heart, and configuration. Firstly, we must determine relative dullness of the heart. When perform percussion of the area covered by the lungs, the dull sound is formed. This area is relative dullness of the heart. Firstly, we must find lower border of the lung with medium strength from second intercostal space along mid-clavicular line. We must percuss until the sound appear, or normally 6 rib. Then after we must jump over 6 rib to the 1 intercostal space or 2 ribs. Then rotate our finger 90 degrees. Then in this position we must percuss towards the sternum with medium strength and mark from clear pulmonary sound. Normally, relative dullness of right border is placed 1 centimeter from the right border of the sternum. Next one, we must determine left border of relative dullness. We ask patient to raise his hands in this position. Please raise your hands, not left. Yes. Along anterior axillary line at the level of 5th intercostal space, we must percuss inward until the sound appear, and then also mark. Then please from upper side also we must percuss and also mark. And normally we found relative dullness of the heart. Border from the right side 1 centimeter from the right side of the sternum, left side in the projection of apical impulse, and upper side in the region of 3rd rib. After, we must find diameter of the heart. We just can calculate right border to the anterior midline and from anterior midline to the point of left relative border. And then we must plus them. Normally it will be 8-9 centimeters. Next one, vascular bundles. Vascular bundles we must find from both sides, from clavicular, mid-clavicular lines at the level of 2nd intercostal spaces. Until the sound appear. Then measure this distance, and normally it will be 6-7 centimeters. Next one, configuration of the heart. We found from the right side points on the intercostal, 2nd intercostal space, 1st intercostal space. From the left side, it's 2nd intercostal space, left vascular bundle, and 5th intercostal space. Now we must find on the points of relative dullness from the right, third intercostal space, from the left, third intercostal space, and first intercostal space. Also, rotate our finger 90° in vertical position and from outward to inward until the sound appears. Then mark and from left side. Third intercostal space and first intercostal space. Then we must connect these lines, and normally we get shape of the head, configuration of the head. Pathological configuration can be aortic and mitral configurations, and position can be vertical and horizontal position. Thank you.